Hi everybody, my name is Dr. Noel McCaffrey. I run a program called Exwell Medical, which offers structured exercise classes to people with different long-term illnesses. We do a lot of work with cancer patients, and I have worked closely with ARC over many years, and I've just been asked to send you a brief message about the importance of exercise at this time with the whole COVID-19 shutdown. So, can I just start by saying that for people at any point along the cancer survivorship journey, from diagnosis to pre-treatment to post-treatment to the period after that, it is critically important to be physically active for your health, just like it is for anybody else. And in my view, there's no reason at all for a person with cancer to feel that he or she should not be exercising. Now obviously there will be times when it's difficult because of pain or surgery or treatment, but as a general rule, exercise has an enormous role to play in keeping you well. Now, over many years working with cancer patients, the feedback we have got has been that following a diagnosis of cancer and during the treatment phase, there can be all sorts of emotions, including a sense of loss, a sense of resentment or anger or fear or lack of loss of confidence, worry, and all of these things can feed into a tendency to just stop doing things you either enjoy or have been doing before. And exercise is a prime example. Now, exercise has so many benefits that you really need an extraordinarily compelling reason to stop doing it, in our view. It is the centre of our business and our offering, and anybody involved in the management of any long-term illness, and some forms of cancer become long-term illnesses, knows that physical activity is absolutely central to maintaining and improving health during the treatment phase. So, with regard to cancer, clearly there are going to be a few specific issues which arise because of either the diagnosis or the treatment. So from the diagnostic perspective, the disease itself can bring certain symptoms which make exercise difficult, including pain or fatigue or weight loss, where there's a lack of strength and energy. And then on the treatment side, you can get complications of treatment, including damage to the peripheral nerves, that's called peripheral neuropathy, or you can get swelling of a limb following surgery, that's called lymphedema, which commonly affects breast cancer patients. Or you can have fatigue as a consequence of radiotherapy or chemotherapy, and you can get nausea as well. Now, the important point is that while these challenges are there, they don't mean you can't exercise, they just mean we need to be careful. And there are many ways to exercise very safely with these complications if they're there. So with lymphedema, we ask people to wear the garment. We avoid really aggressive or repetitive upper limb repetitive work, but we don't not do it, because there is some evidence that in fact exercise helps with lymphedema. It doesn't make it worse. With fatigue, cancer-related fatigue, which is that fatigue which is not improved by a night's sleep, there is evidence that gentle exercise can modify that fatigue and in fact improve it, not disimprove it. With peripheral neuropathy, that can give you altered sensation in your hands or feet, or it can give you altered what's called motor function, and you can become a little bit clumsy or unsteady. And we just need to be aware of that if you're exercising, and not ask you to do things which are a little bit risky, like agile work or dancing or running backwards. So, but for example, it's obviously very safe to sit on a bike and exercise because you're holding on, you're unlikely to fall off it, and your feet are on the pedals, so you're perfectly safe. So all of these things are challenges, but they're not reasons not to exercise. And there's now a growing body of evidence that if you're, for example, preparing for cancer surgery, that the fitter you are, the better, both mentally and physically. And we have found that people who are preparing for surgery really enjoy group exercise classes. while getting ready for it. It's something to do. You meet people on the same journey as you meet people who've come back from the surgery and they're still alive and they're doing well, and the whole thing is far better than sitting looking out the window waiting for the big day to come. So in a general way, an exercise program for cancer patients should start like any other program. So you start off gradually, you ease into it, you combine aerobic exercise with strength work, with core stability and balance work, and all those components are important, and you can get them on YouTube, get them from booklets. We ourselves in my own program are in fact moving to the home program space because we can't do group exercise anymore because of COVID. And so there's many offerings that people can tap into. But the critical message I want to give you is, don't be afraid of exercising. Do it and enjoy it, because it helps you to get back to being who you are, or who you were, and who you'd like to be again. It can improve your health. It's fantastic for your resilience and for your mental wellness during the cancer journey to be seen to be active and even improving your fitness. It's a fantastic way to spend your time. It also means that you're taking control to some extent of your own health, all of which is good. So if I can be of any help to any of you, you can link with me through your ARC offices and I can give you advice if I can. But the main message is, don't be afraid. Get out there and do it, and start tomorrow. Thank you.